one of the big questions we have in mind, is how do we choose a patient, their upfront treatment in general. So we don't know at this point whether it's better to use a BTK inhibitor upfront in a fixed duration manner with a CD20 monoclonal antibody versus venetoclax plus monoclonal antibody. So I think that's a big question that a lot of us are having. And before these data, most of us were thinking of BTK inhibitors as kind of continuous therapy option. And so that it kind of made it an easier discussion with patients to say, do you want to be on a BTK inhibitor for the long term, or would you want to be on a potential treatment that's fixed in duration? Now that we have this data, it makes things even more complicated because we have an option where we can combine these two targeted agents, both oral agents, and get really remarkable responses and potentially be able to stop that treatment and then just reinitiate treatment at the time of progression. So I think that's a big question, what to do in the front line. And along with that, if we use kind of our most potent drugs up front, will we have options later on for patients as they progress? I think that also remains a concern.